Congressman James Clyburn, the number 3 Democrat in the House, joins us now from Hilton Head, South Carolina. Congressman, welcome. I wanted to ask you about what Congressman King said. He suggested the president and the administration was not fast enough in responding to this. What's your reaction to that?
Well, first of all, thank you so much for having me. Peter King is a good buddy. He is given to a little bit of hyperbole sometimes. I think that the president, in his response, is doing exactly as he should do. I think that in so many instances, these terrorists get more benefit from the reaction they cause than from the action they take. And so I believe that for the president to be very measured in his reactions, not elevating this thing to the point that it would be satisfactory to terrorists is exactly the way to do it. I think Secretary Napolitano is out there today talking about this issue. I have been in touch with the Situation Room of the White House. I've been briefed. I have talked with Congressman Bennett Thompson of Mississippi, who chairs the Homeland Security Committee, and I am very satisfied that everybody is doing what they ought to do with this instance.
Based on your briefings, Congressman, how big of a deal is this? I mean, was this a narrow incident, or do you think this represents a much bigger problem?
Well, from all that I have heard, I think that this is a very narrow incident. Now, the fact of the matter is, we see something taking place here that disturbs me a little bit. I remember the incident of the shoe bomber. I think Mr. Reed, if I might call him Mr., the same flammable material, explosive, that he used seems to have been used in this instance. So it would seem to me that some kind of secondary screening may need to take place in certain instances, and hopefully in order to detect that kind of substance.
Quickly, Congressman,
that to me,
does that mean for you a full body pat down, just quickly?
Well, I'm saying secondary. How you describe that secondary, I think, would be based upon where the airplane is originating from and what kind of security measures they have on site.
All right, let me now switch to the topic of health care, which was the other big story we were going to talk about until this breaking news. The Senate has passed its bill. Can you sign on to what the Senate has passed?
I think that our process calls for us to now meet in conference. I believe that both the House and Senate bills make tremendous contributions toward bending the cost curve. I think they do a great deal to bring more people into the system. I think, though, that the House bringing the 36 million additional people, the Senate bringing 31 million additional people, I think that the more the merrier in this instance. So I do believe that the Senate has done a very good bill. But I think that the House has done a very good bill as well.
Congressman, you were a strong advocate for the public option. Sent a letter to the president, said don't waver on this. It's not included in the Senate bill. Can you vote for a final health care bill that does not include a public option?
Yes, sir, I can. Because why do we want a public option? We want a public option to do basically 3 things: create more choice for insurers, create more competition for insurance companies, and to contain costs. So if we can come up with a process by which these three things can be done, then I'm all for it. Whether or not we label it a public option or not is of no consequence. What we want to do is get good, effective results from whatever we put in place.
A number of other public option supporters who shared your passion for the issue feel that the president let them down a little bit on this, that he didn't fight very hard for it, that he was kind of stringing them along through the process. Did he let you down?
No, he did not. If you may recall, I said way back before we went out on our August break that we ought to take a hard look at this so-called robust public option that a lot of people had bought into. I never quite bought into that. I was one of those people saying we ought to come up with a hybrid, part of which was to bring more people into Medicaid, and that's what we did on the House side. We did a blended plan. We didn't do what you might call a robust public option plan on the House side. What we're saying is, on the House side, let's increase eligibility for Medicaid from 133% of...
I'm afraid we're going to have to leave it there on the details.